In this episode we will talk about fibroids. I have lost an aunt due to them because she discovered them late. Disclaimer: we are not medical practitioners. If you experiencing any of the symptoms, please consult your medical practitioners. Let's teach each other. Uterine fibroids are growths made up of muscle and connective tissue. Uterine fibroids, also called leiomyomas, are growths made of muscle and tissue that form in or on the wall of your uterus. These growths are usually not cancerous, benign, and are the most common non-cancerous tumor in women and people assigned female at birth. Where do fibroids grow? Fibroids can grow as a single nodule, one growth, or in a cluster. Clusters of fibroids can range in size from 1 mm to more than 20 cm, 8 inches, in diameter or even larger. For comparison, fibroids can be as small as a seed or get as large as a watermelon. These growths can develop within the wall of your uterus, inside the main cavity of your uterus or on the outer surface of your uterus. Types of uterine fibroids. There are different types of uterine fibroids depending on where they're located and how they attach. Specific types of uterine fibroids include intramural fibroids. These fibroids are embedded into the muscular wall of your uterus. They're the most common type. Submucosal fibroids. These fibroids grow under the inner lining of your uterus. Subserosal fibroids. This type of fibroid grows under the lining of the outer surface of your uterus. They can become quite large and grow into your pelvis. Pedunculated fibroids, the least common type. These fibroids attach to your uterus with a stalk or stem. They're often described as mushroom-like because they have a stalk and then a wider top. Are fibroids common? Fibroids are a very common type of growth. Approximately 40% to 80% of people with a uterus have fibroids. Some fibroids can become pedunculated fibroids, which means that the fibroid has a stalk that attaches to the uterus. Symptoms. Most fibroids do not cause any noticeable symptoms. However, some can cause significant discomfort. The symptoms of uterine fibroids can include heavy periods, also known as menorrhagia, which can lead to anemia. Painful periods. Lower backache or leg pain. Constipation. Discomfort or a feeling of fullness in the lower abdomen, especially in the case of large fibroids. Frequent urination. Pain during sexual activity, also known as dyspareunia. Some people may have fertility problems associated with fibroids. Fibroids may cause problems during pregnancy and labor, and they increase the chance of needing a cesarean delivery. Some sources suggest that removing fibroids can improve the rates of conception and live births, though there has been some controversy around this. More research is necessary. If fibroids are large, there may also be weight gain and swelling in the lower abdomen. Complications. Uterine fibroids often aren't dangerous. But they can cause pain, and they may lead to complications. These include a drop in red blood cells called anemia. That condition can cause fatigue from heavy blood loss. If you bleed heavily during your period, your doctor may tell you to take an iron supplement to prevent or help manage anemia. Sometimes, a person with anemia needs to receive blood from a donor, called a transfusion, due to blood loss. Pregnancy and fibroids. Often, fibroids don't interfere with getting pregnant. But some fibroids, especially the submucosal kind, could cause infertility or pregnancy loss. Fibroids also may raise the risk of certain pregnancy complications. These include placental abruption, when the organ that brings oxygen and nutrients to the baby, called the placenta, separates from the inner wall of the uterus. Fetal growth restriction, when an unborn baby doesn't grow as well as expected. Preterm delivery. When a baby is born too early, before the 37th week of pregnancy. Is highly variable depending on the location and size of fibroids. This is not an appropriate treatment method for all types of fibroid. Lifestyle changes. Maintaining a moderate weight by getting regular exercise and eating a healthful diet may help moderate estrogen levels, which may help reduce Consistently heavy periods may affect a person's quality of life. Significant blood loss may also lead to anemia. Some people might develop urinary tract infections as a result of fibroids. Some people may also experience pregnancy problems. Preterm birth, labor problems, and pregnancy loss may occur, as estrogen levels rise significantly during pregnancy. There is not enough evidence to conclude that myomas reduce the likelihood of becoming pregnant with or without fertility treatment. That said, there is fair evidence to suggest that hysteroscopic myomectomy for submucosal fibroids improves clinical pregnancy rates. Uterine fibroids are almost always benign. Cancerous fibroids, known as leiomyosarcomas, are rare. According to some sources, they occur in fewer than 1 in 1,000 cases. If there are severe symptoms, various medical or surgical treatments can help relieve pain and discomfort.